Good morning. Welcome to Hot Seat. I'm Scott Mitchell. My guest this morning, Dr. Justin Ramsey, Children's Center, Health Center out in Bethany. Good to see you.
Yes, great. It's nice to be here.
All right, cerebral palsy. We'll call it CP henceforth. So the issue is something that a lot of people know the name. They know something about the disease. There's a conference coming up. We want to get into that. You have a mild case, and you are working with families who have children with CP. There's not a lot of talk about it, but it's important. Tell us why you're having this conference, and for parents, a lot of people are affected by this in this country, why the conference and what we should know.
Sure. Well, cerebral palsy, CP, is the most common movement disability of childhood. It's a misnomer to consider a pediatric condition, as 60% of the people alive are adults, and that is something that we're trying to change in perception. But those children can have issues with pain, spasticity, or increased muscle tone. This conference is going to try to address the social isolation. We'll have some medical components. There will be a physician who treats individuals with CP, Dr. Cynthia Walzow, who also has lived experience. But we're going to try to help create that sense of community. So there will be parents sharing their stories, both mothers and fathers, and there will be siblings. We chose to focus on siblings this year because sometimes they're the lost story in the household, and it's an important story to tell as well.
And you said that some families become isolated, and now we're getting into behavioral health issues, of course, but
Sure.
This is something that this conference is going to address for people who may be in a situation where they think, I really don't know other people, don't really know how to reach out.
Well, if you take let's imagine a situation in school. So maybe you're the only person in that school that has CP. Maybe in some cases, you're the first case of CP that school has ever dealt with. So it's easy to feel isolated when you're not able to access every part of the school. That can be social isolating. So this is allowing individuals and those parents, those families know, hey, this happens. Your experience, why is your experience and unique? It's not uncommon, and there are similar trends that people experience.
And we've got a link that you can go to register for the conference, but for our folks that are watching in Tulsa and Oklahoma City that may have not heard of the Bethany Center, Children's Center, what is the specialty there?
Sure, it is a private, freestanding pediatric rehabilitation hospital where the focus is to treat largely children with physical disabilities. And so there's multiple components, including pediatric rehabilitation medicine, which is myself. There is neurology. There are hospitalists that take care of kids with a lot of chronic sick needs, such as traumatic brain injury.
Is CP increasing, declining, staying the same? And if it's staying the same, why is that, do you think?
So the incidence is about 1 to 3 per 1,000 live births. It's staying the same relatively, with perhaps a slight decrease. The reason why is because the neonatologists are getting better at saving children that didn't used to live. So they're getting better at preventing CP, but at the same time, they're saving kids that are at extremely high risk that didn't used to be saved. So it's kind of a good news, bad news sort of description.
Got about 30 seconds. What is the main thing for people who are just now watching this topic and may not have family members that have CP? Why is it important we become educated on this issue?
Well, it's one of the most common movement disorders, so likely you'll run into somebody that has CP. I think it's important to know that it's a huge, CP is an umbrella term that describes a huge amount of individuals, including myself. But it has a huge impact on their communities, and those people are members of those communities, many of which can have jobs, some of which have needs, and they can use help.
Dr. Justin Ramsey, thanks for being here. It's an important conference, and hope folks will learn more about that. You can see that in our show description that we'll have here on News 9, News on 6. The event is Saturday, March the 2nd at 9 o'clock at the Bethany Children's Health Center. Hope you can make it out there. Thanks for being here.
Thank you.
Thanks for watching Hot Seat. See this again at News 9 and newson6.com. Follow me on my socials @Mitchell Talks.